Health officials are closely monitoring an outbreak of a highly contagious virus suspected at a half a dozen healthcare facilities across the state. It took Wahiawa General by surprise when so many of their patients and staff came down sick over the weekend because they've never had to deal with an outbreak of this magnitude. KITV4's Catherine Cruz has the exclusive story.
Hospital officials hope the worst is over now after an illness spread at an alarming rate over the weekend and into Monday. The hospital says its outbreak affected 26 patients and 6 staff, but it was primarily limited to the first floor of its long-term care unit.
Sunday we had 15 new patients who were exhibiting the symptoms, and it was like 4 on Tuesday, 4 on Wednesday, and 1 on Thursday.
Workers scrambled to move patients into isolation, then started an intense process of disinfecting the whole place. Olden said the hospital has not yet found a common thread, but it was concerned because the long-term facility is connected to the main hospital by hallways.
Limit the staff movement so that the staff are not moving between, say, our skilled nursing facility and the acute hospital.
Officials suspect the problem is a norovirus, a gastrointestinal bug that is also called the cruise ship virus. It causes severe vomiting and diarrhea and can be airborne and foodborne. And in outbreaks in places like care homes and long-term care facilities, the health department must be notified.
While norovirus may not usually cause deaths or severe complications per se, in this particular population, so the elderly population, they're at more risk for the complications of dehydration, related to dehydration.
Dr. Park says while most places on the mainland are currently wrestling with the flu outbreak, that's not the case here in Hawaii right now.
We're actually a little more worried right now about the norovirus infection.
The best advice to avoid getting sick or spreading the disease is much like the flu.
Washing hands. If you're sick, especially if you're sick with this particular infection, stay home.
Now, Dr. Park says it does not appear there is a single source linking the outbreaks across the state. So far, they believe they're tracking different strains, but different strains mean it's being generated out in the community and coming into the facilities from visitors or staff. Back to you.